Hello, my name is Michael Hara, and the app I assessed and will be talking to you about is the UpToDate app. UpToDate is a great application that any healthcare professional can download directly on their phone. It is compatible on iPhone devices, Android devices, tablets, and desktop computers. The application provides clinical decision support resources updated regularly by more than 7,100 world-class physician authors, editors, and reviewers. Content provides evidence-based information and recommendations. It helps clinicians and patients learn important medical knowledge, allowing for optimal outcomes. And it is used by more than 1.9 million clinicians in 190 plus countries. Multiple studies have been done to show how the usage of UpToDate has improved patient care and hospital performances. One study found that in smaller non-teaching institutions, there is a small but reliable correlation between the use of UpToDate with shorter lengths of stay, lower risk-adjusted mortality rates, and better quality performance. UpToDate consists of a vast amount of information and features for just about any healthcare professional. They have topics covering up to 25 specialties. They provide practice-changing recommendations, which are updated consistently. Over 1,500 patient education materials are provided, and an in-depth drug reference database is provided by Lexicomp containing important drug information and interactions. If you look over to the left, you can see a small sample of the contents provided by UpToDate, such as practice-changing updates, patient education tab, authors and editors, cardiovascular medicine, dermatology, emergency medicine, and if one was to scroll down, they would see more topics such as pediatrics, palliative care, psychiatry, just a vast amount of specialties one can see. Looking here is an example of what the user would see if they clicked on anxiety for adults. They'd be able to get evidence-based recommendations for anxiety and schizophrenia, the approach to treating generalized anxiety disorder in adults, or an overview of anxiety and palliative care, and the list goes on. You can do this for any mental disorder under the tab Psychiatry. Multiple medical calculators are also provided by UpToDate, allowing providers to use common formulas to obtain important numerical data. Here you can see you can pull up a pocket calculator for the CWAL assessment and perform it directly off your application. Looking on the screen here to the left is an example of the patient education tab for opioid use disorder. Although this is opioid use disorder, this can be pulled up for any type of medical diagnosis or disease. The information can be printed out and provided directly to the patient, and it can even be translated to a different language. Pictures and tables can also be included to help the patient if needed. Overall, this is a remarkable app. Although there are some minor cons, such as minimal customization, you do need a subscription, and the cost could be pricey at $559 a year if not provided by your institution. Some of the pros include it's accessible on all phone devices, tablets, and computers. The app is consistently providing evidence-based information that is peer-reviewed, and the app is consistently updated with new information as needed. I chose this app for my career because it allows mobile access to evidence-based recommendations for making clinical decisions and can help improve my patient outcomes in a variety of settings. I will have access to treatment and diagnostic recommendations for a variety of mental health disorders, a large amount of information on psych drugs and their interactions, accessible information to provide patient education, access to mental health screenings, and notifications on practice changes and new information coming out regarding psychiatry. Thank you for viewing this video, and if you are a healthcare professional, I think this app will greatly benefit you and your patients.